Have you ever really stopped to think about what happens in the first few minutes of a person's life? It is, without a doubt, one of the most incredible journeys in all of nature. We're talking about a transition more dramatic than a rocket launch, the switch from a world of water to a world of air. So let's break down exactly how this miracle happens.
Okay, so check this out. Before birth, life support is, beautifully simple. The placenta does everything. But then, in a literal instant, that one single system is gone. And it's replaced by this whole new suite of complex systems you see on the right. Lungs, heart, digestive system. They all have to fire up perfectly, all at the same time. Talk about a massive biological challenge.
So, how on earth does a baby pull this off? This great transition is really a cascade of physiological miracles, a complete rewiring of the body. And it all kicks off with the most urgent task of all, taking that very first breath. Think about it. The lungs have to go from being these quiet, fluid-filled sacs to powerful air-breathing organs in just seconds. First, all the new sensations, the cold air, being touched, trigger those first gasping breaths. Then all that fluid that was inside the lungs gets squeezed out and absorbed by the body. And finally, and this is crucial, the resistance in the lungs' blood vessels just plummets. That's the green light for blood to start rushing to the lungs to pick up oxygen.
A newborn's breathing is also totally different from ours. They are belly breathers, so you'll see their abdomen moving up and down. Their breathing can also be periodic, meaning they might breathe fast for a bit, then pause for a few seconds. That's completely normal. And here's a big one. They are what we call obligate nose breathers. They pretty much only breathe through their nose, so even a little bit of congestion can be a big deal for them.
At the exact same time the lungs are firing up, the heart is going through its own revolution. Before birth, the circulatory system works in parallel. You can think of it like an electrical circuit with these special shortcuts that let blood bypass the lungs because, they weren't being used. But after birth, that whole setup has to instantly switch to a system in series, where blood follows one single continuous loop right through those newly working lungs.
And this is how that amazing rewiring happens. Remember that drop in lung resistance we just talked about? Well, that's the trigger. This sudden change in pressure causes two fetal shortcuts to functionally slam shut, a little flap in the heart called the foramen ovale and a vessel called the ductus arteriosus. Once they close, bam, the whole system is rewired into that serious circuit, ready for a lifetime of breathing air.
All right, so the internal engine is up and running. Now, let's take a look at the outside. A newborn's appearance can have a lot of unique features. So we're going to do a quick head-to-toe tour to see what's totally normal, what's just a common variation, and what might need a second look. First up, you might see this stuff called vernix caseosa. It's this cheesy white substance, and yeah, it might look a little strange, but it's actually an amazing natural moisturizer. It's been protecting the baby's skin for months in the womb and continues to act as a protective barrier right after birth. You might also spot something called a Mongolian spot. This is a super common, totally harmless, bluish-gray birthmark. You often see it on the lower back or bottom. It's nothing to worry about, and it usually fades away on its own in early childhood.
Sometimes the pressure of birth can cause a cephalohematoma, which is just a collection of blood under the baby's scalp. Now, the key thing for doctors here, the way they can tell what it is that the swelling is contained within a single skull bone. It does not cross those suture lines on the skull.
And that brings us to the reality that this journey, as miraculous as it is, can sometimes have its obstacles. The process of being born is physically demanding, and sometimes it can lead to injuries or trauma.
When you look at the numbers, it turns out that somewhere between 2 and 7% of all newborns have some kind of birth-related injury. Now, the significance of these can range from something super minor that resolves on its own to, in rare cases, more serious complications.
So what puts a baby at higher risk? Well, the factors can come from a few different places. Some are related to the baby itself, like being very large, that's called macrosomia, or being born too early. Some are maternal factors, like if it's the mother's first birth or her physical stature. And some factors have to do with the delivery itself, like if instruments are needed or if the baby is in a tricky position. Let's walk through a few of the most common ones, because they often aren't as scary as they might sound. A broken collarbone or clavicle is actually one of the most frequent injuries, but it heals really quickly, often without anyone even noticing. Facial palsy from pressure on a nerve is another one that's usually just temporary, and a subconjunctival hemorrhage, that little red spot in the white of the eye, Looks dramatic, but it's completely harmless and just fades away in a week or so.
Okay, so after navigating this incredible and sometimes challenging journey, the focus shifts entirely to supporting this new little person. Let's look at the evidence-based principles that guide modern care to give every single baby the healthiest possible start in life.
It really boils down to this core set of rules for healthy newborn care. The big ones are promoting that mother-child bond right from the start, not separating the baby from the mother, supporting breastfeeding, making sure parents know what to look for, and of course, performing those crucial health screenings.
And really, the whole philosophy behind modern care can be summed up perfectly by this idea. The goal is to be as hands-off as is safely possible. It's about trusting the natural process of adaptation and stepping in only when it's truly necessary. It's all about facilitating, not forcing, this incredible transition.
It's just incredible, isn't it? From one simple life support system to a whole symphony of independent organs, all in just a few minutes. This journey is so brief, but its success truly lays the foundation for an entire lifetime. It really makes you think, what more can we do to protect these first few precious moments and ensure a healthy future for every child who makes this amazing leap?